Hey, Assalamu alaikum. Today we are going to discuss about the Sinovac, which is an influenza vaccine. This vaccine is against the influenza virus, which causes the many symptoms of flu and many other symptoms. Today we are going to discuss how it works, what are the composition, and how many immunity and how the immunity works against the influenza virus after the influenza vaccine. What is the process of influenza vaccine? What is the full name of influenza vaccine? Basically, this is an influenza vaccine which is a Split-virion, inactivated, and quadrivalent. So this is the name, and now I am going to tell you about what is the process of Sinovac influenza vaccine. This is work by stimulating the body's immune system to produce a humoral antibodies against the influenza virus. This process provides the active immunization and protection against the four specific strains of influenza virus, which are included in the vaccine. What is the mechanism of actions? First of all, what comes in the mechanism of action is the vaccine composition. As the name shows that this is a quadrivalent. Quadrivalent always comes from 4. So this is made from 4 strains, which is the 2A subtype and the 2B subtype. What is the second process of mechanism of action is inactivation and splitting. This is basically an inactivated vaccine. It means that the viruses are cultured in fertilized hen's egg, then harvested and then chemically inactivated. During the inactivation, we usually use formaldehyde. So that what will happen when we inactivate the vaccine? It do not replicate, it do not complete its cycle, and that's why it does not cause any illness in the body. The virus particles after the inactivation, the virus particles are disturbed and purified into a smaller pieces, which are called split-virion. This is called split-virion. When we disturbed and purified into a very smaller pieces, it is called split-virion. So this is split-virion to remove. When we make the split-virion, it is to remove most of the viral genetic material so that it cannot replicate and reduce the side effect while keeping the key antigen intact. What are the administration of this vaccine? This vaccine is administered as the intramuscular injection, IM, which is an intramuscular, and mostly in the deltoid muscles for adult and children also, older children also. What is the immune response triggers by this vaccine? Basically, once injected, immune cells in the body, which are antigen presenting cells, absorb the inactivated virus which is in the vaccine. This absorb the inactivated virus fragments and then display the specific component, particularly hemagglutinin HA antigen on their surface. After that, this will going to produce the antibody. Antibodies are produced by the helper T cells. Helper T cells basically recognize these fragments which are on HA antigen, on the surface HA antigen like. Then they triggers the B cells to produce specific antibodies against the 4 strain, which is 2A and 2B subtypes. And this whole process of making antibodies take 2 to 3 weeks after the vaccination. What is the protection of these vaccine? These antibodies circulate in the bloodstream, and upon exposure to live influenza virus, this is a dead or you can say inactivated influenza virus of the same or closely related strain, they bind to the viral hemagglutinin and neutralize the virus, preventing it from infecting cells and causing illness. The best thing you can say is this influenza virus always change its strains after 1 year, so this vaccine is valid for 1 year. You can see this is a strain for 2025 to 2026. This Sinovac vaccine is made from this is the brand name, basically Sinovac Biotech Code Limited. This is the influenza virus vaccine with the expiry date, with the lot number. You can say this is the expiry date till 26, because this is valid for only 1 year. Thank you.